And welcome to the University at Albany Center for Public Health Preparedness Grand Round Series. I'm Chris Smith, and I'll be your moderator today. Before we begin, we would like to remind you to please take a moment after the broadcast to fill out your evaluation. Your feedback is very important to the development of future programs. I'd also like to remind you that we will be taking your questions later in the hour. The toll-free number is 800-452-0662. You may also send your questions by fax to 518-426-0696. In addition, we have audience members in our studio today, and we hope that they'll have questions too. Today's program is called Transportation and Public Health Preparedness, a focus on rail transportation. Our guest speaker today is Dr. John Silvernail, Director of the Public Health Emergency Epidemiology Program at the New York State Department of Health. He is also the Chief Medical Officer of the New York State Task Force 2 and a preventive medicine resident at the University at Albany School of Public Health. Welcome, John, and thank you for joining our program today. A lot of impressive credentials.
Thank you, Chris. Nice to be here with you.
Well, obviously, based on the title, we're going to be talking about railroad issues. Could you start by discussing why that's even important?
Well, how about we talk about transportation in general, Chris, and how people and things get from place to place is a very important part of public health, and it's an underappreciated part of public health. Everything that we use was transported at some point in its existence, and the products that we use or foods that we eat could be corrupted at any point along that transportation, either by accident or intentionally. People use transportation. Pets and livestock are moved by transportation services, and in the past there are many historical transportation events that have been major disasters, and there will be again, unfortunately.
So big picture, why railway transportation specifically today?
Well, I think railroads are especially underappreciated. We move vast quantities of hazardous materials by rail. Railroad service points store large quantities of diesel fuel. For example, there's a commuter facility that stores or has a storage capacity of 250,000 gallons of diesel fuel, and a major freight railroad facility that has a storage capacity of 3 million gallons of diesel fuel. So I would consider that a fire service problem as well as a public health problem if something goes wrong with it. The other part about railroads is that much of their physical plant is unguarded and easily accessible.
What do you mean by physical plant?
Physical plant refers to all of the parts of the railroad that don't move. It's the ground on which the railroad is built, it's the tracks, the power system, the switches, signals, detectors, all of that sort of stuff.
So I'm going to let the audience in on something that they're going to be well aware of by the end of this hour. In addition to all your other impressive credentials, you're quite a railroad fan, and you're a font of knowledge on this. Now, as someone who doesn't know that much about railroads, I think about trains carrying chemicals and the impact that could have on the environment, but what other public health impacts might occur?
Well, Chris, much of our food moves by rail at some point from production to ultimate destination in the market or on our dinner table. A lot of grain, corn syrup, many different types of products, food products move by rail, especially produce. A lot of produce moves from the West Coast to the East Coast in refrigerator cars. We also need to think about passenger rail service. Commuter railroads move many people in and out of major metropolitan areas on a daily basis. Amtrak still runs intermediate and long distance trains, trains within a state or trains that cross state lines. There are also trains that cross international borders. And in many cases, the railroad right-of-way or physical plant lies in the poorer parts of our communities where the vulnerable populations are.
And I think, looking back to that phrase, wrong side of the tracks, that's pretty apparent. And General Honore, who led the response to the Katrina disaster during the economic crisis, I heard him speak, and he said, we don't need to be talking about Main Street, we need to be talking about Railroad Street and the people who really are most vulnerable. So that makes a really good point, I think. Yes. Looking back in time, what have railroads done in terms of occupational health and safety?
After a slow start, railroads have done pretty well with occupational health and safety, Chris. Initially, in the early days of railroading, many injuries. As time went on, they did better and better at preventing injuries and even developing some healthcare systems.
Traditionally in public health, John, it seems to me that we need to focus our limited resources on high-frequency events. Now, train derailments don't, fortunately, happen that often, so why do we need to worry about, spending resources in preparing for that?
That's true, Chris, and this is really an important point, that most of public health is about high-frequency things. We're always looking to get the most for our money. We're looking to have the biggest impact that we can, touch as many lives as we can, so we tend to focus on things that happen frequently, and that's very appropriate. But we also need to plan for things that don't happen frequently, because the high-risk, low-frequency event does put large numbers of people at risk. So in public health parlance, the population at risk is very large.
Before the broadcast, you were giving me a fascinating case study about an incident in the Baltimore train tunnels. Can you talk about that to the audience?
Sure, we can touch on that. In July of 2001, there was a train derailment and fire in the Howard Street Tunnel in Baltimore. This event lasted for several days. It collapsed several city streets. It collapsed a 40-inch water main, disrupted telecommunications and internet service. It developed street-level traffic, caused evacuations of many, many thousands of people in the city of Baltimore, as well as snarling freight traffic up and down the East Coast, because that was sort of a congestion point.
So how many different types of responders had to respond to that event?
Fire service, hazmat, EMS, police, law enforcement, structural folks, utility folks. It really drew on every discipline that was out there.
Public health as well?
Public health as well, absolutely.
So we need to give special attention to the high frequency incidents, the high potential, but equally as much to those that have high consequence, even if they occur very rarely. What would that look like if you were to put it on a map?
Well, the slide that's up now is kind of the classic risk versus frequency evaluation, with increasing risk on the left axis and increasing frequency on the right axis. And things that are low frequency and low risk, even if they go bad, the outcome is not going to be terrible. Low risk, high frequency events, same thing, the outcome's not going to be terrible. As we get into high risk, high frequency things, even though they're risky, we tend to do those pretty well because we're familiar with them. That red box, the high risk, low frequency event, or high risk, high consequence, low frequency event, is where we tend to get in trouble. We don't do those often, we don't have a lot of experience, we don't have the information loaded in our hard drive to deal with those necessarily. So that's where planning and training help us to deal with those types of incidents.
And we get criticized sometimes for planning for something that is unlikely to happen, spending precious resources. But of course, if we didn't plan and it happens, the criticism is going to be justifiably even worse.
Yes.
So that's a difficult one. Well, maybe we can focus on the topic, and to understand trains and the railway system as a pertinent public health issue. What do you hope the viewers will get out of your presentation today?
Well, first, Chris, whenever I talk about railroads with health folks, I like to review the railroad healthcare systems because I think there's some important lessons to learn there. So we'll take a few minutes to do that. And then really, this is sort of an awareness level program. I want public health folks and other practitioners to be aware of what the railroad is, what its physical plant is, and we'll go over that, the various types of equipment that are used, what the operations of the railroad look like, and then we'll talk a little bit about what I call railroad special events at the end.
So give us the historical perspective, if you would.
Well, as railroads moved west, there was a lack of healthcare infrastructure, and they decided that it was best to just build their own. So they developed extensive healthcare systems. These were used to treat employees, their disabled folks, family members, retirees, and in some cases even the general public were serviced at these facilities.
One of the things that, again, we talked a little before the program, and you had mentioned that the railroads actually set up their own hospitals.
Yes.
It's one of the options they gave to their employees. Can you take us through some of that?
The railroads, mostly the Western railroads, had full service hospitals. Some of these even featured residency training programs. They also developed what today might be called urgent care centers. They had occupational health clinics. And in small towns, they contracted with local physicians to provide services to their employees and families in those locations.
You even provided us with some pictures of these historical hospitals. So if we could see those, John can talk about what we're seeing and the impact.
Sure. I chose a couple of pictures just to kind of illustrate what these buildings look like, so that people could say, yeah, there really were railroad hospitals, and that they were not insubstantial structures. This is a beautiful Spanish-style hospital in Los Angeles, California. It belonged to the Santa Fe Railroad. The next slide is another one of Santa Fe's hospital called the Coastline Hospital, also in Los Angeles. The next slide is the C&O's Clifton Forge, Virginia Hospital. A little different style, but still an impressive structure.
Very Victorian.
Must have started out as a Victorian house. And finally, there's a picture of the chief surgeon and his residence at the the Missouri Pacific Hospital in Kansas City.
Those are great pictures. I'm glad you brought them today.
And I should mention they come from a website called railwaysurgery.org, which is run by another physician and fellow train enthusiast, Robert Gillespie.
Again, thank you for bringing those to us. But back to present day, earlier you talked about the physical plant. What are some of the features of the physical plant? And again, that's everything that doesn't move down the tracks.
That's right. The physical plant includes the ground on which the railway is built, the track appliances, systems that power the trains. So why don't we take a few minutes and we'll go through those things sort of one at a time.
That's great.
And
railroad right-of-way.
We'll talk about the right-of-way. Again, this is the ground that the railroad is built on. And we really should think of that as a long and skinny piece of land. Railroad should be thought of mostly as a long and narrow thing with widenings or bulges at terminals and yards and places like that. Abandoned railway right-of-ways make excellent walking paths and cycling paths. And this is a shot of the former New York Central Harlem Division line down near Hillsdale, New York.
They call them rail trails, correct?
Yes, rails to trails projects, which are very valuable. They preserve that railway right-of-bed, they preserve that transportation corridor, they provide a linear recreation place for people to walk and exercise and enjoy nature.
Public health, in fact.
Public health things, yeah. Provide access to places that you normally wouldn't get because of where they are located.
And I just want to mention that these series of pictures we're seeing, you took those pictures, didn't you?
Yes, many of the pictures in this I took myself.
So a photographer as well as a railroad expert and a public health expert. So what are some of the safety concerns associated with the railroad tracks themselves?
Okay. The track consists of the cross ties, the rails, what are called tie plates, which are the metal piece that the rail sits in. There's spikes, and then all that crushed rock is called ballast, and that kind of helps hold it all together. And it's been said that railroads have been built with three things in mind: drainage, drainage, and drainage. So they're built to shed water so water doesn't accumulate and wash out the tracks or the right-of-way.
And that means that if there's a spill of chemical from the train,
absolutely.
Where does it go?
If we spill a liquid product on the railway right-of-way, many times it will have easy access to some waterway. It will be shed from that right-of-way and into the surrounding waterway.
So a potential contaminant to a public water supply.
Absolutely.
And where were we looking at that? Did you say near Selkirk?
That picture was taken off the 9W overpass at the south end of Selkirk Yard or east end of Selkirk Yard.
So you also mentioned switches as part of the track system. So how could they potentially be sites of accidents?
Well, we need to move trains from one track to another, and that happens at points that we call switches. And they're important because switches could be intentionally misthrown. They can be accidentally left in the wrong position. Or sometimes we see what we call picking the points, which is whereas the railcar wheels come through the switch, they catch the rails the wrong way and are taken the wrong way when the train was meant to go the other way. And that frequently leads to a derailment.
Oh, very unfortunate if that's going to happen. These, again, are your pictures of railway features. Can you walk us through each of them and explain what they are?
Sure. This first picture is of a railway switch at Chatham, New York. In the left lower corner, you can see the switch machine that moves the points. The points are the movable rails that are facing you. And this is what we call a left-hand switch. As you face the point, the diverging route is called left or right, depending on which way it goes off of the track that you're on. The next picture is kind of an important structure. This is a multi-detector arrangement on the main line along the Hudson River. And this is used to detect hot wheel bearings, count the axles in the train, and there's also what we call a dragging equipment detector. So even if you say, well, geez, the trains never stop in our area, we don't have a railway yard, if you have one of these detectors, the trains may get stopped there.
And how frequently are these detectors located?
It depends on the traffic on that railroad, but say maybe every 50 miles or so, every 75 miles, somewhere in that ballpark.
So I want to go back to a point you just made, because it's something that people might not think about. Certainly in doing vulnerability assessments, I'm sure the public health community has looked at if they have a freight depot in their community, in their jurisdiction, or if they have a passenger station, the public health impacts of that. But from what you said, if a detector is out in arguably the middle of nowhere and detects a problem, that train's going to stop.
Yes.
And then whose problem is it?
Whosever jurisdiction that is.
Is it likely that they've planned for that?
Probably not. And this is from my hometown area, and to most of us, the railroad is just the train whistle in the distance that we hear along the river.
Now, this was taken where, John?
This is at milepost 121, which is off of 9J in Stuyvesant, New York.
Yeah, again, in our preliminary conversations, you mentioned that the milepost designation is important. Why is that?
Well, railroads, for the most part, don't use GPS. While they are creating GPS or GIS maps of their facilities, railroads run pretty much on what are called mileposts, and the milepost tells the distance from a given structure. In the case of the Hudson Division, we're talking milepost 121 is 121 miles from Grand Central.
And again, you took that photo. Can we see that photo again? Because there's a structure there. I'm not sure if. Next photo, please. I think there's a structure I'd want to judge.
The next photo. This is part of that detector system.
Okay.
And this is what we call a dragging equipment detector. And you can see it's a little bit beat up. So obviously there's been some dragging equipment that has hit this detector. This would catch dragging air hoses, dragging signal lines, perhaps a wheel that was off the track might hit that detector. So again, this would be something that would stop the train if there was a potential mechanical problem.
And what's a signal line?
Signals are carry electricity and train signals from car to car.
We have a couple of more pictures that you'd taken, and if we could take a look at that, perhaps
Sure.
John could talk about. Is that a signal that we're looking at right now?
That detector is connected with this signal. They're very close to one another. That's the milepost 121 signal. And again, this is a train control point, so it's a place where trains can be stopped or might stop based on the railway traffic and direction and so on. The next picture is an overhead signal bridge. Same idea. There's the ability in this area to move from one track to the other, so there are signals to control that movement. You'll also see a track coming out of the picture at you, and sort of along the right side of the tracks is a switch machine, and that machine is connected to a linkage that will work the device in the next picture, which is something we call a derail. And derails are a safety feature on the railroads that are used to protect high traffic portions of the railroad from sidings and other tracks where a runaway train could come and block or foul the mainline track. So for this particular detector that we're looking at, when the railroad needs to run a piece of equipment on this track, that switch is opened, the derail is open, the equipment is backed past the derail, and then the switch is closed, closing the derail and protecting the main line.
You had mentioned, not during the broadcast again, but before the broadcast, about the city of San Francisco derailment. And that was just a fascinating story. Can you talk about that a little bit?
Yeah, the city of San Francisco train wreck was an intentional derailment of a very busy passenger train in the late 1930s, early 1940s. And the rails were actually separated so that the train was put on the ground, as we say, or derailed. And this was done in basically the middle of nowhere. So again, in a place where the only thought of the railroad would have been the train whistle in the distance. And this resulted in many injuries and many fatalities as well. And
not to do a how to derail something, but the derail function, it seems to me that there needs to be high security around that. What's happening with that?
This device is mounted on the tracks. It's linked through an extensive linkage to that switch machine. While it might be possible to disable that linkage and work this manually, it would be a difficult job.
And generally, it's located some distance down the track, the facility where they operate the derail?
Yes, and this would be remotely controlled from the train dispatcher's office.
Well, I've been on passenger trains and commuter trains, and they mainly seem to use electricity for power, because when we get down in the tunnels in New York City, everything goes black for a moment. So how much energy is needed to use or to run trains that use electricity?
Well, in powering electric trains, there are really two systems that are in use, Chris. There's what we call third rail power, which is literally a third rail alongside the rail that the train runs on. And in the New York City area, that third rail is powered with 600 volts DC. And then in places where there are overhead wires, such as the Northeast Corridor, that's called catenary, and that's powered with 6,000 volts AC. So not insubstantial amounts of electric power in these facilities. So there's an electrocution hazard, especially with the third rail, because that's down on the ground. But you could also come in contact with energized live wires that might be down from a storm or something from an overhead system as well.
So that's catenary is the overhead system?
Catenary is the overhead system, yes.
Okay. Well, we're now looking at a picture, I believe, taken in Harmon, New York.
This is a vintage picture from Harmon, New York, not taken by me. The photographer's name is in the credits there. And that shows the third rail pretty well alongside the larger of the two black locomotives. And you can see that that's a structure that stands up alongside the rail. And from the truck on the locomotive, there's a where the wheels are on the locomotive, there's a little tab essentially that comes over and contacts that rail to draw the power into the locomotive.
I think the next slide we're going to view is an Amtrak train. Can you talk a bit about that one?
This is a more current view of what train travel looks like.
I think I've been on that one.
Okay, this is the Northeast Corridor, probably somewhere between Philadelphia and New York. Not a picture that I took, also, by the way. The overhead lines are 6,000 volts. You'll see that there are concrete railroad ties, which is a new development in railroad building. And again, heavily ballasted. This is 4 tracks. There's a lot of traffic on that Northeast Corridor, Chris.
How effective is the concrete?
Well, at least in the Hudson Division, they replace ties with concrete ties. Normal railroad ties are wooden and treated with creosote, which is a pesticide essentially.
Health hazard itself.
Yeah, potentially a health hazard itself. And they replaced the ties with the understanding that those ties were going to last for about 50 years. They're now at about 12 years old, and many of them are needing to be replaced already. So their lifespan was not quite what was advertised.
And if they're not identified as having problems, is that a potential for derailment?
Yeah, if weak railroad ties are present, yes, that can be a problem with the track. Usually not on main lines, but certainly weak rails make it easier to derail the train.
There's several different types of railroad equipment currently in use. Could you take us through those and tell us why it's important to differentiate between them?
Sure.
Actually, among them is
among them.
the correct
Yeah, let's
grammar.
start with freight equipment. Let's talk about freight equipment a little bit. And there are many different types of freight equipment. Some of these are designed to carry one specific product or one specific load. Many of them are able to carry many different loads, depending on what we put into those.
What type are we looking at there?
That's a boxcar in front of us, and there's some tank cars off to the right. That's not a photo that I took. Just kind of to show what a freight yard might look like and the variety of some of the cars that you would see in a freight yard.
Close by Railroad Street.
If we move to the next slide, you see that there are some pictures of different cars there. The top left are covered hoppers that haul grain. The bottom left are tank cars that haul corn syrup, and we've got a larger picture of those. They're the corn syrup tank cars. Those haul 16,000 gallons of corn syrup, or they could haul corn oil. Generally, it's some corn product as it's labeled, but many times corn syrup for mixing into drinks, beverages, other food products.
Is that a potential for contamination, deliberate or inadvertent?
Yeah, that 16,000 gallons would go into a lot of products. And if that was intentionally or accidentally contaminated, that's a potential to hit a lot of people with that one event.
That's the sweetener they use in so many products.
And so many of the things that we drink and so many of the things that we eat that are made commercially.
You talked about hopper cars. What do they
Yes.
carry?
Hopper cars haul products that need protection from the weather. So the ones that are shown in the program here are actually hauling grain. And this was taken down in the Hudson, New York railroad yard. And unmilled grain comes in these cars. It's hauled to a milling plant in Hudson. It's processed there. Some of that is hauled out by truck. Some of it may be hauled back out in other cars similar to these. These cars are very large. They haul 100 tons of grain at a time. So again, if you were able to contaminate that stream of grain, you have the potential to introduce contamination to many places as that product is used.
And obviously I'm not saying that this is what happened, but I remember an outbreak of Salmonella agona several years ago associated with cereal. So it would seem to me that there is a potential to contaminate a lot of cereal by just getting your hands on these grain cars.
Yeah, as food processing has become more centralized, one small introduction of contaminant can go a long ways.
Again, when I see a tank car, you showed us corn syrup, my thought immediately goes to something very problematic such as ethanol. What kind of risk could that create?
Well, this ethanol is hauled in very large tank cars, and the tank cars that are on the screen now are 30,000 gallons apiece. And this particular train is called a tank train, and these are interconnected, and which allow the train to be filled and emptied from one end. So that may be 8, 10 cars in some places. There's one railroad that hauls a train of these that's 95 cars long. So 95 cars, each with 30,000 gallons of ethanol in it. That's a whole lot of ethanol coming down the tracks at you.
It sure is.
You know.
And do you think that enough attention's been given to that?
It's very high on the railroad's priorities. They are very concerned about moving that much of a flammable liquid. And we do have a shot of some problems with ethanol cars when they go bad
Okay,
further on in the
we'll
program.
wait for that one. That's
so.
good. You know, I guess if you don't live right along the tracks, you don't think too much about freight trains. They're just there. You don't really spend a lot of time worrying if ethanol is going to, you know, catch on fire in your jurisdiction if you're just a resident there. But most of us have taken passenger trains. What are some of the concerns that are associated with passenger trains?
Well, passenger trains have the potential for the unintended spread of communicable disease. There's a pretty famous case in Amtrak history of a patient with tuberculosis who was active with tuberculosis and taken off a train and required the tracing of folks on that train and evaluation of people who had been on the train with that individual.
What would happen there? Can you take me back to that? If the person was taken off the train, would the fellow passengers have to be quarantined?
It wasn't known immediately what his illness was. He was taken to a hospital and diagnosed with tuberculosis, and actually died a few days later. So he was quite ill with tuberculosis at the time, and
They must have had to do hundreds of tracebacks.
there was a tremendous amount of traceback with that incident, Chris.
That takes some planning. We already mentioned commuter trains, but a lot of us are very familiar with those two. Maybe we could focus in a little more. These trains, obviously, there are just a high volume of people taking these trains on a daily basis. What are some of the risks associated with commuter trains per se?
Commuter trains, high volume of traffic. So again, there's potential for derailment or collisions. We've seen a number of collisions on commuter railroads, usually because of human error, but sometimes because of physical plant errors or malfunctions. When we look in the New York City area, MTA or Metro North, on a daily basis is a ridership approaching 1 million folks. The Long Island Railroad even more. So there's a potential for communicable disease transmission in these settings. There's a potential for chemical or biological attacks, explosive attacks.
Sarin.
We mentioned that, yeah, when we were talking before. We shouldn't forget that the sarin was used very effectively in the Tokyo subway attack in 1995.
Do you have a little bit of a background on that for those who might not be aware of it?
In Japan, a cult, the Aum Shinrikyo cult, used sarin nerve gas in an attack on the Tokyo subway system. It's produced many, many casualties. I forget how many deaths there were at this point, Chris, but it drove people out of the subways and to the hospitals with illness from that contamination.
And of course, we saw the London subway bombings, and most recently in New York City, the plot
there,
to bomb the subways. So,
which was thwarted.
Yeah, thank goodness.
And another successful bombing in Spain, and there was one in Russia recently too.
So this has to be part of the high consequence, if not high frequency planning that we need to do.
We do need to think about it and understand these things and plan for these sorts of events.
I think you brought some pictures from Metro North. That's a bi-level coach.
The bi-level coach is actually from the Chicago area. That's the one on the right in the picture. And that probably runs what we call push-pull service. If you see, there are two small windows in the upper level of that coach, and that probably represents a control stand. And push-pull means that the train runs into the station, and the crew moves from one end to the other end of the train, and then operates the train back out of the station. On the right is a shot from the Metro North website of one of their commuter trains, a typical self-propelled commuter train in the New York City metro area.
Yeah, I'm not sure if Metro North has them, but I know Long Island Railroad has the bi-level trains as well. Yeah.
Yes.
And speaking of Long Island Railroad, fortunately, quite a few years ago, but remember the gunman who got on at rush hour and so all sorts of things you have to think about.
Yeah, many connections between the railroads and public health and public safety. And to me, public health and public safety are one and the same.
Well, yeah, just keeping people from injury and disease, right?
Yes.
Is there a difference between how passenger trains and freight trains are operated, and does this pose any public health impact?
Sure. Again, let's talk about freight first. And think about freight trains as being unit trains, which move one single commodity. So that might be a unit coal train or a unit oil train, a unit ethanol train.
But they're not all unit trains.
No, they're not all unit trains. And then we have what are called mixed freights, or might be called merchandise freights, that haul many different commodities, all going to different places. Unit trains pretty much start at one place, run over the railroad to a given destination. For example, a coal train running from the mine to the power plant, and then that's cycled back to the mine. An ethanol train from the point of production of ethanol or ethanol gathering to a refinery where that's blended with the gasoline.
I think there's actually a unit train that runs from the West Coast to very close to here in the Capital District of New York State. What is that?
There's a dedicated cold service that runs from 2 points on the West Coast called RailX. This is a CSX product, not to endorse CXS, but it is a CSX operation, also handled with some of the other railroads in the West. The train is loaded at Wallula, Washington, or Delano, California. And those products are moved across the country on a 5-day schedule, arriving in Rotterdam, New York, where they're offloaded at a facility in Rotterdam. And then any cold requiring shipments from the east are loaded at that Rotterdam facility into the train, and it's sent back to the West Coast.
Are there detectors to make sure the temperature control is always appropriate on those trains? I'm thinking again in terms of food safety.
Yes, the refrigerator cars are all self-powered. They have a diesel engine that runs the refrigeration system on those. There are thermostat controls and those sorts of things to help protect that commodity in transit.
Keep that cold chain intact.
Yes.
That's too much H1N1. Yeah, we've been focusing on that too. I think your next slide is that terrible picture of the ethanol fire.
Almost. First, we have a picture down in the Port of Albany of ethanol cars when they're not being a problem, and this is just that's the
way we like them.
That's the way we like it, absolutely. This is down on the former D&H or Canadian Pacific Railway in the Port of Albany, and they're moving a string of ethanol cars. That would be those tank train cars that I showed you earlier. And then the next picture is a picture from the Chicago area of an ethanol train derailment. And you know, ethanol is highly flammable. So once you get that burning, you have a tremendous amount of heat, a tremendous fuel source. Again, 30,000 gallons of flammable liquid per tank car. That will ensure fire for a long, long time to come.
We never want to see something like that. And before we move ahead, I wanted to discuss this with you because it always fascinated me. A few years ago in South Carolina, I think of Aiken, South Carolina, a train derailed and spilled chlorine gas. Now, unfortunately, the firehouse where the first responders were located was well within the danger zone, and those who had planned to respond weren't able to because they needed to evacuate. In fact, some of them needed to be hospitalized. So how much do we need to broaden our planning?
Well, again, you need to understand what the railroad is, what it does, and how that relates to your operations near that railroad. And that's a very tragic case that sometimes fire stations are disabled.
And there was also hospital surge issues there as well. And then because what I normally do is risk communication, a huge media impact. Public health had to be ready for just a national influx of media and be able to deal with that.
And again, a low frequency but a very high consequence event. And even one point, since you brought that up, Chris, one point that I'd like to make about some of these tank cars is that even when they're empty, they're not empty. That many of these tank cars have what we call a residual. And let's say that's 2 to 5% of residual. So do the math. You know, that still leaves, if it's a 10,000 gallon tank car, that's 200 gallons of product in that car that can spill and cause a problem. If it's a 30,000 gallon tank car, that's about 600 gallons of product that's in that car, even when it's empty.
I recall getting a call about 5 in the morning, and the information was that a train car hauling not a radioactive cask, but the residuals, the radioactive material had been delivered, but it had derailed in a populous neighborhood. And fortunately, everything worked out well. The systems were implemented as planned. Everybody was prepared. But you just never think that's going to happen in your neighborhood, and it can.
No, and I didn't touch on in the presentation the railroad movement of nuclear materials, but that is a concern. Although I will say that the casks used to move that material are nearly indestructible. Nothing's indestructible, but they're built very, very strong and built to withstand quite an impact and a great deal of heat as well from a fire.
Yeah, and that was the case in that instance. It derailed, it toppled over, but upon inspection there were no breaches. And everything was fine, but it did cause a lot of response, as you might imagine. Earlier, you mentioned intermodal trains in one of the slides as another type of equipment. Could you talk about those?
Sure. Intermodal means moving products that are containerized. So they may be containers or they may be piggyback trailers. Generally, we think about containers more so today because the railroads don't want to spend extra fuel hauling the wheel sets. The wheel sets can be at the point of delivery. So really, it's an efficient way to move materials. Intermodal service, pretty much you look at a port of delivery, so maybe Long Beach, California, somewhere like that. Intermodal ship comes in, those containers are offloaded, they're sorted, they're placed on trains that carry those to various distribution points along the country, and they're served at dedicated intermodal terminals where there are the right type of cranes to move the containers off the train. There are the wheel bogies to load them on so they can be moved by highway. So you should think about intermodal traffic as the long haul being done by the train and the short to intermediate haul being done by road on the back of a truck.
But that brings up a point, because obviously these crates come in to a port, and obviously they do their best at security, but not every crate can be checked, can it?
Not at present, no, and this has kind of been a sore subject in Homeland Security circles, that it's very difficult with the many, many containers that come through to scan or inspect every container coming through. So a very, very large percentage of them are scanned, but not 100%.
And did I understand that these intermodal trains move at a very high rate of speed?
Yeah, these are special service trains. They move at nearly passenger train speed or at passenger train speed. Many times they have priority over some of Amtrak's passenger trains to move those products from the port of entry to their ultimate destination.
Especially if the freight company owns the tracks.
Absolutely,
That-
which is the case nowadays.
And that's why you need the switch.
Yes.
So that the passenger train is safely to the side as everything goes
So
by.
the trains can get out of each other's way.
Maybe we could look at passenger operations now. Do the risks vary depending whether the trains have to cross state lines?
Sure. You know, we said that, you know, with commuter service there's a risk of communicable disease transmission. Same thing with intercity trains. That, you know, again, the train is a long tube, potentially facilitates the distribution of an infectious disease, whether it's intentionally or accidentally released. If you were to release a chemical hazard, a biologic hazard in that train, that tube helps to maintain that hazard on board. We also see difficulty in tracking infections and contacts of cases on board the train. You know, on most airliners, you have an assigned seat.
Yes.
And, you know, we can pull the manifest for that flight and know who was sitting in front of you, alongside you, and back of you, and do a pretty good job of tracing contacts. On the train, there are no assigned seats. You know, if you're in a Pullman car where you have an assigned berth or room, that's a little bit different. But in a coach, that's just open seating. So it's much harder to track those contacts. And the train stops at multiple stations along the way, so people get on and off at different points, have different travel times on that. At least with an airliner, a flight starts and terminates, and everybody gets on or off at the same place. So the railroad's a little more complex from an investigation standpoint.
Do the commuter trains have any specialized equipment that might help us to respond or to prevent issues?
No, most of the commuter services are you ticket and ride, and you buy a ticket and you get through the gate and you get on the train and you go into the city. So
Well, I'm glad you're raising awareness, because it sounds like there's an awful lot of planning that has to be done around this. The bigger trains have got their own set of issues, however, right? Because they're going longer distances.
Yes. You know, again, the more time that you're on the train, if there is somebody with a communicable disease, the more time that you have contact with that person. If there was an agent released on that train, again, more contact time, the more likely that's going to have an effect on you. So that's an important consideration. Some of the longer trains even have checked baggage service, so you can check baggage on board those trains. There are also potentially issues with the food service.
That's right, more likely to be consuming food.
Yeah, the longer distance trains still will prepare full meals, where the shorter, commuter trains and shorter intercity trains usually have a coffee service, maybe muffins or something like that. But on long distance trains, there may actually be full meal service still on some of those routes.
And some of those long distance trains cross international borders.
Yes, in New York State, for instance, we have a couple of trains that cross the border in the Niagara Falls area going to Toronto every day, and we get a couple of trains that cross the Canadian border going back and forth to Montreal every day. So as the trains cross the border, it may provide a route for infections to cross the border.
And then, of course, you have jurisdictional issues as to who's in charge of the response, or where is that train held, what side of the border, and whose hospitals do they go to. The planning around that is probably pretty robust, I would imagine.
Our border health folks are doing some work on that. In fact, there's an exercise plan for this fall for the Buffalo area, Niagara Falls area, using a train scenario and an infectious agent. Yeah,
well, based on some of the discussion we're having today, I think the more exercises along these lines, the better. You brought along some more pictures that I'd like you to walk us through. I could try to describe it, but I'd get it wrong.
This is a shot of a typical Amtrak train over in the Rensselaer station. Most of these short-haul trains are a locomotive and 4 to 5 cars moving between two locations. This one would be bound for New York City with intermediate stops between here and New York City. The next picture, all the way to the right, you're just seeing the locomotive. And this is of a longer distance train. This is the Boston section of the Lakeshore Limited, which will ultimately go to Chicago. This section of the train will arrive in Rensselaer. It'll be joined with the New York City section of the train, and then that train will go on to Chicago, and people will potentially disperse to other trains moving to other destinations across the country from Chicago. So you can imagine trying to do the contact tracing and infectious disease tracking if there was an infection being spread aboard a train like that.
Actually, I couldn't imagine how it would get done.
It would be very, very difficult. And here's a sort of a going away shot of a typical Hudson Division Amtrak train. Again, 4 coaches and a food service car headed south or east to New York City.
I want to take a moment to just add a reminder that we will be taking your questions in just a few minutes. The toll-free number, once again, is 800-452-0662, or you may send us your written questions by fax. That number is 518-426-0696. So we really do want to hear your questions. John, we talked about the functions of the railroad. You're getting people and things from place to place. People might not have thought about another function, which is as the site of special events. What kind of crowds are drawn to railroad special events, despite people, in addition to people like yourself that are railroad fans?
We may see many hundreds to sometimes many thousands of folks drawn to the railroads for various special events. Some of the typical examples that occur in our area are the Polar Express. A number of the tourist railroads run Polar Express trains. A number of tourist railroads hold a day out with Thomas, where you get to go meet Thomas the Tank Engine. And then there's also a Little Blue Engine Who Could train that travels around and visits some of these tourist lines.
I don't know why I haven't found any of these.
I'll send you the information.
Okay.
Canadian Pacific every year runs a Christmas lights train along their active commercial railroad, which draws a number of folks to the sides of their railroad to see this Christmas lights train go by.
I actually have seen that. That goes through my town.
Yes.
I've had to stop and wait because of that, but that's fine. That was really kind of cool. So these special events trains are coming to your town. What impact does that have on local public health planners?
Well, I think first of all you got to be aware that these things happen. Your first responders, fire, police, and EMS should know that these things happen because they typically happen on weekends when staffing is down, command staff is thin, public health usually doesn't work on the weekends. So you really need to know about these things in advance and plan for them. Local hospitals may want to anticipate mild to moderate surges, again, depending on what the event is. Most of the time it's going to be healthy folks coming, enjoying a train ride, and going home. But if there is an accident or some event aboard that train, they're going to go to the local hospital. Our public health people should know about these events. Many times they involve food service and things like that. And again, anytime you bring a large number of folks together, there's that communicable disease issue, Chris, and that should be thought about.
Absolutely. It sounds like a lot of these events take place over the holidays. Can you talk about the Disney Christmas Carol train?
Sure. This was a train I actually had the opportunity to visit last fall. This arrived at the Albany Rensselaer train station September 22nd, as you can see the date in the picture. And this was Disney promoting its movie that was coming out later in the fall for the holiday season. And the train toured the entire U.S. In the fall of 2009. Now, unfortunately, this also toured the country during the H1N1 pandemic.
Great timing there.
For perfect timing. Again, the train was essentially a long tube, which people entered at one end, walked through, enjoyed a number of hands-on touchable exhibits, touchscreen computers, and really there wasn't an ability to sanitize your hands within the train, which is good and bad because the hand sanitizers are flammable as well. They're 70% ethanol or 70% isopropyl alcohol, excuse me, so they're flammable. So it's probably not a good thing to have that in the closed environment, but it might have been good to have a good sanitizing station at the end once people exited the train.
Outside, like with petting zoos.
Yes.
Yeah. Obviously, no running water available on that. So.
And the train really did draw large crowds. And when I was down in midday, it was a relatively short wait to get aboard the train. Later on in the day, some folks who had visited told me that it was about 3 hours wait. So there was a very large crowd to get aboard that train.
You brought us some more photos.
And there's a couple of pictures of the Disney Christmas Carol train here. This is sort of the tail end of the train. That last car in the picture is where the crew rode and slept. The next to last car, which you're not quite seeing in this picture, is where you dismounted the train.
Oh, there it is.
This is where you got aboard. This
Oh,
is
okay.
towards the head end of the train. They had that little platform so you could walk up and enter the train. And then you essentially walk through that long tube, experience the different exhibits, the touchscreen computers. It really was kind of a pretty cool thing. But again, a long tube, a lot of people, middle of the pandemic, potential for spread of flu or other communicable diseases in that environment.
Mm-hmm. You know, we still are ready to take your call, so we encourage you to give us a call. And again, the toll-free number, 800-452-0662, or you may send your written questions by fax if you're shy to 518-426-0696. We encourage you to do that because John is an absolute wealth of information, and I know I'm not hitting all of the topics, you know, based on my questions. So we really would like to hear from the folks.
Very complex topic, hard to do it justice in this short period
It's
of time.
all over the place. It's hard to get your arms around it, but there isn't a question about railroads that you don't seem to know the answer to. So I'm thinking you are number one resource on this one. If we're talking about a holiday train, I want Christmas cookies. So are we talking, you know, potential hotbeds of foodborne contamination?
Well,
People, you know, I don't want this cookie, I'll have another one.
Yeah.
And by the way, I just sneezed into my hands.
Cookies are probably a low-risk
Oh,
food
good.
to serve. And I will say this past year, the cookies were individually packaged at the Polar Express.
Oh, good.
And the Polar Express is very well attended. My experience with the Polar Express has been with the Adirondack Scenic Railway, again, not to endorse them, but they do operate out of Utica.
Okay.
And their trains operate from around Thanksgiving. They start usually the weekend after Thanksgiving, and they run till just before Christmas. They draw very large crowds. Each section of the train, and they typically run 2 to 3 sections of the train a night, meaning they run the train 2 or 3 times a night. And each of those trains carries about 2,000 people. You know, that's adults, kids, you know, grandparents. So about 2,000 people per train. So if you looked at a Saturday night in Utica, you might have the influx of 6,000 people into the Utica Union Station area to participate in the Polar Express.
And that has potential hospital surge issues.
Hospital surge, traffic surge, restaurant use, lodging use. You know, you're bringing a large number of folks into the community for that weekend. It's good for the community, but you gotta plan for the potential downside of that many folks coming in.
And it boards at the home station. Where does it go?
The train travels from the home station to the quote-unquote North Pole, in this case Holland Patent, New York. At the North Pole, Santa does board the train, and then Santa moves through the train. They have multiple Santas that move through the train and visit with the children and families aboard the train. And then the train takes a nice slow ride back to the station. Here's a group of happy Polar Express riders about to board the train this fall.
Including, I think, a couple of very adorable kids who are close to your heart. And we have a better picture of them talking to Santa. There you go. There you go. Hopefully the kids were vaccinated and didn't make Santa sick.
Yes, they were.
I don't think he was in a priority group.
And they were well prepared to ride the train. And my twin sons, Thomas and Russell. Thomas is the one with the hat on. Russell's the darker-haired one.
Adorable.
And,
Thank you for sharing that with us. All right, we're putting you on the hot seat now. Are you ready?
Okay.
We're going to the audience. We want some questions from the audience. I see someone who might be a volunteer.
Are there any documented cases, either purposeful or accidental, of collisions with trucks containing explosives or hazardous materials where trucks intersect with roads? And do most trains slow down when approaching such intersections in the hopes that any potential collision would be less severe?
That goes to the at-grade crossing issue we were talking about earlier.
Yeah, we didn't touch on grade crossings, and Kristen, thank you for that question. Grade crossings are where rail meets road, and these can be very well protected or they can be unprotected private crossings. There are many instances where trains, both passenger and freight, have struck vehicles at these crossings. Sometimes accidentally, sometimes intentionally. I'm not aware of one of these being done as a terrorist attack. I am aware of some of these being done as a suicide by train, where someone who's despondent may pull their personal vehicle on the tracks and wait for the train to come by and kill them. And we've seen a couple of these in Columbia County, actually.
Other questions from the audience?
Follow up on that. Can you talk a little bit about stopping distances and the problems of crossings that aren't gated?
Sure,
which
that's
is-
a good point.
Is that a
and
Western?
that ties into Kristen's question as well. And trains moving at speed on the main line may take over a mile to stop. Again, depending on the speed and the tonnage of that train, but you may look at a mile or sometimes even 2 miles to stop a train at speed. So when they're approaching these grade crossings, protected or unprotected, they're not slowing down. They're blowing their horn and they're not slowing down. So even if they see a vehicle on the track, they can't stop. And just down the road here in Castleton a few years ago, there was a tractor trailer full of paper crossing the crossing there to go into the printing company in Castleton, and an Amtrak train went right through it and spread paper all over the north end of Castleton. I will say, in an effort to protect these crossings, very high-risk crossings are sometimes being eliminated.
Well, I was going to ask you, in the urban planning, we're seeing now they're putting overpasses.
Overpasses in Alameda, they've got that whole corridor that they literally sunk the train track below grade and basically give a big trough. Here in the Port of Rensselaer, many of the gasoline tanker trucks used to cross the Amtrak main line and CSX main line going into the Port of Rensselaer.
That can't be great planning.
No, that crossing is still there, but it is gated and fenced off and usable by the railroad, usable in emergency situations, but it's not open for day-to-day traffic anymore. And that was a real safety concern and eliminated a safety concern by gating that crossing.
Yeah, and I guess people have to be aware as well that they don't have all the time in the world, that the trains may seem far away, but in fact, they're...
They also, if you're walking along the track, the trains tend to sneak up on you. The welded rail, the roller bearings in the trains make these very smooth and very quiet in this day and age, so you often don't hear them until they're right on you.
I'm told we have another question from the audience, so let's go to our audience.
I was just wondering if you think parts of New York State are better prepared or worse prepared for a disastrous derailment, say cities versus rural areas?
Well, my hope is that all of New York is prepared for one of these events, but I think, again, if you don't consider the problem, you can't prepare for it. And I originally had put this lecture together last summer for the other preventive medicine residents because I feel that understanding transportation is part of public health preparedness. It's part of general emergency preparedness. And Chris mentioned the New York Task Force too, that I'm also a longtime firefighter and first responder myself. And I'll say that even my home fire district, we've done probably a fairly poor job of preparing for the railroad in our area. And again, it's that train whistle down by the river that we listen to and enjoy, most of us, but we haven't given it a whole lot of thought.
So I have a fax question from Bob from Wisconsin, and actually Bob has about 6 questions in one. So we'll start
Wow.
with the first and then we'll go from there. And actually it's a very current issue. What can you say about people texting or intoxicated while conducting a train?
Wow.
Don't do it.
Yeah, don't do
That's
it.
the easy answer.
Don't do it.
You think that's a common problem?
Well, the railroads all do have drug-free workplace policies. They do mandatory drug testing. Any of those systems can be beat. Texting, talking on the cell phone is a problem not only in rail transportation but in many other forms of transportation. Probably a bigger issue in highway transportation, but there was that derailment, I want to say that was in Maryland, that involved somebody texting right before the collision.
Bob would also like to know, and I'm sorry, that's Barb from Wisconsin. I apologize, Barb. Do you know how fast trains go on average and the average number of cars? I suppose that's all over the place.
Yeah, that varies a lot by the type of railroad, the carrier. And so the typical Amtrak short-haul trains are usually 4 or 5 cars long. As we look at the trains that run from Albany to New York City, those are 4 coaches and a food service car. Longer trains, maybe 10 or 12 cars, perhaps maybe 12 to 15 cars. And some of the big intercity trains. Commuter trains are usually 6, 7, 8 cars, maybe at maximum in that ballpark. Speeds vary tremendously based on the type of railroad. Passenger trains along the Hudson Division are permitted 90 miles an hour and in excess of 90 miles an hour in some places.
Mm-hmm. Barb wanted to know the risks for rural versus urban areas, and maybe I will combine that with a question that I have, which is we've had such a broad-based discussion, and can you boil it down into 3 take-home messages for our audience?
Sure. I think that you ought to know what railroads are in your jurisdiction. You ought to be familiar with their physical plant, for example, their fuel storage capacity. That's a big issue in terms of some of the terminal areas. You should know what the railroads carry in your area. There may be one specific product, there may be many products, there may be one particular hazardous material that's moved in large quantities because of a facility in your area. And you also ought to know about the freight or passenger operations in your area. How many passengers move on those trains, how many trains per day, so that you can plan for that low frequency, high risk event when that derailment does happen with a passenger train.
Should you plan on using passenger trains in mass evacuations?
That would be a good thing to do, Chris. You know, trains are nice because you can, whereas a bus or an airplane has a fixed number of seats, a train you can almost always add another car with more seats to it, assuming you have that car available.
And the railroad industries, you think, have done a pretty good job at planning, and how about integrating their plans with public health in the various jurisdictions?
I think they're doing better. I think, you know, we probably need to, from a public health standpoint, need to engage the railroads a little bit more to work with them. I know our office has done some of that in terms of looking at distributing medicines and things like that into New York City. But I think we probably could do a better job of reaching out to the railroads and working with them.
And they're pretty much a part of a traditional vulnerability assessment, though.
Yes.
Yeah, so.
Yes.
Well, a lot of things to think about. And if people want additional information, where should they go to find it?
Well, from a historical standpoint, I would refer them to Dr. Gillespie's site, railwaysurgery.org, to look at the history of railway medicine. There's also some information there about railway hospital trains. And an interesting and sad operation that the railroads did after World War II, DOD ran special funeral trains for repatriating fallen American soldiers. And moving their remains around the country. So railwaysurgery.org has a lot of great history about railway medical programs. Trains Magazine, good information about current railway operations. The National Transportation Safety Board, and the National Academies has a transportation division that has some railway publications as well.
Well, we got your take-home messages, so I want to thank you for joining us. It is all the time we have today. We would appreciate, of course, if you would please take a moment to fill out your evaluations online at the website listed on the screen. This program, by the way, will be available via web streaming next week, so please check our website for more information. I'm Chris Smith. We'll see you next time at the University for Albany Center for Public Health Preparedness Grand Round Series. Thanks, John. That was great.